You know what needs to change. You know what's wrong. We gotta treat people the same. We gotta get along. Do you know the history of the country where you stand? Do you know how they treated the first people of the land? Do a little research. I know that it might hurt. Open up your mind, son. Then come back, we can rewrite. Do a little research. I know that it might hurt. Open up your mind, son. Then come back, we can rewrite. Come back, we can rewrite.
Thank you for having me, and first of all I'd like to acknowledge the traditional owners of the land, the Aranda people, past, present and future. My name's Annie Tangey. I'm the Health Information Manager at Ngaanyatjarra Health Service. My role also covers research, coordination. Ngaanyatjarra lands are located in a very remote part of WA in the eastern goldfields. It's some 1,000 kilometres to 850 kilometres from regional towns of Kalgoorlie and Alice Springs, and our administrative office is located in Alice Springs. Ngaanyatjarra Health Service is one of 6 entities of the Ngaanyatjarra Group. They have the same elected board of directors, and Ngaanyatjarra Services looks after the business arm, so there's a business arm of that group. The synergies of the group enable strengths of collective collaboration. There is one representative board member from each of the 11 communities, and there's also 4 ladies who are elected to ensure gender balance. The board members, generally English is their 3rd language. So anything that's presented to the board or discussed needs to be well thought through. So for the health service, that means that the clinical governance group and senior management team make sure that information is well articulated and thought through before it's presented to the board. There are also 2 independent directors who assist in that process. The priority for Ngaanyatjarra Health Service is to provide primary health care. There's 3 broad areas that we deliver services. That's in clinical, public and preventative, and aged and disability care. Nurses do provide 24/7 emergency care, which causes nurses to be fatigued quite often. Primarily the 11 we have 8 staff clinics, and primarily staffed by remote area nurses and some Aboriginal health workers and practitioners. We have a variety of programs, an aged care facility, and we're also an NDIS provider. There was 2,600 unique people who had 27,000 episodes of care in the previous financial year. You'll note on this chart that a quarter of our regular clients, these are clients that have had 3 visits in 2 years, are considered transient patients on our system, and this means they've got an address off the lands. We encourage research that supports better care and prevention, which is articulated in our strategic plan, and we want that research to be culturally responsible, be community driven and align with our priorities, and has support and resources, and involves employment of Yaananyu, which is Ngaanyatjarra people. Currently we have 8 projects that we're working with, and 4 of these are Carson projects. 3 of them you'll hear about shortly. As I mentioned before, primary health care is our priority. And sorry to speak in a deficit model here, but this is the reality of challenges faced by our primary health care service, and that's issues of distances, logistics, isolation, cultural safety, overwhelming burden of chronic disease and fatigued staff, and also the time that's needed to develop meaningful relationships. So thinking about the strengths when it comes to doing research, the number 1 priority for us is relationships. And the relationships and respect and advocacy, a respect of our advocacy role. And also research needs to be contextually correct for cultural safety. We need to build capability, there needs to be flexibility, and we also think it's really important to go bush and hear stories and understand country and have the privilege of learning more about culture. Also of significance is working Malpara Way. And working Malpara Way describes a long-term co-worker relationship between a Ngananyatjarra and non-Ngananyatjarra people being paid to work alongside each other using their different areas of expertise. Malpara Way fundamentally recognises that the exchange of skills, knowledge and experience goes both ways. Everybody has things to learn, everybody has things to teach. The end.
You know who needs to go? The intervention as a whole. Stop controlling my people.